this course, we're going to discuss how to prepare for weight loss surgery. Now, I look at weight loss surgery patients as being in one of 5 stages. This first course is going to cover the first stage, preparing for surgery. Once you prepare for surgery and then undergo surgery, you'll enter the next phase, recovering from surgery, which is really the first month or so afterward. Then you enter those blissful honeymoon years where the weight falls off effortlessly and you have excellent control of your hunger and have a strong desire to exercise, and finally, for the first time in your life, feel like you are in control of your weight. And then, inevitably, the honeymoon ends, and you're faced with the reality that weight loss surgery is not the magic bullet, but is merely a tool that, when used appropriately, and when you're able to get the right result or the best result from your genetic makeup, as well as a lot of other factors that affect your health, that you can work over the years to manage and control your weight. And then finally, we enter the lifelong period, which is 5 or more years beyond, where there are certain issues that will crop up and you are at risk for weight regain. And there's a lot of things that need to be addressed during this phase. So we're really going to focus on the first topic, which is preparing for weight loss surgery. And the first question that I think every patient should ask who is in this stage of the process is, do I really need surgery? And we give a lot of lip service to this topic, but really what it comes down to is that surgery should be reserved for those patients who are unable to lose weight by any other means. And as we've talked about in other courses, there are 4 different ways to lower your set point. There's nutrition, there's exercise, there's medications, and then there's surgery. We use surgery when the first 3 don't work. And that point is made over and over again, and a lot of times it kind of just glosses over our head without us really understanding and thinking about what that means. But that is who should undergo weight loss surgery, is someone who, through a reasonable amount of effort and commitment, is not able to control their weight. Then that's when we turn to surgery. And this requires a very honest assessment of how you got here, how you gained your weight, and what efforts in the past you've made in order to lose weight. Have you really given this everything you've got? And if the answer is yes, then I think it's very reasonable to proceed with surgery. Another part of the course is going to discuss your surgical options. And there's really 4 options that we commonly perform in the United States. There's the gastric bypass surgery, the sleeve gastrectomy, gastric banding, and duodenal switch. Now, these surgeries are really not performed very often, and we're not going to spend a ton of time talking about them because I think they're only the right choice for a very small percentage of patients, maybe 1%, and this surgery probably isn't the right choice for anyone. So we're going to focus on the gastric bypass and the sleeve gastrectomy, which are 2 excellent surgeries, and each have some pluses and minuses to them. And then we'll address complications, and this is obviously a area of concern for anyone going through surgery. If these surgeries were complication-free, pretty much every single person out there would be lining up for them. And while a lot of people focus on the short-term complications, the truth is we've gotten incredibly good at performing these surgeries and can do it with a very small complication rate. And when those complications do arise, we can almost always, with exceptionally few instances where we can't get people back on their feet in a relatively short amount of time, back to work and back at a high level of functioning. I've had some patients have serious complications and still be back at work in 3 weeks after their surgery. So while these things do arise, they are much less of a concern than I think they have been in years past. Where we really should spend most of our time is discussing long-term complications, things that happen a year, 2 years, 5 years, 10 years out from surgery. These are the things we see with more frequency. Again, they can be managed, but when you choose to have these surgeries, you often will end up having some form of health problem that you wouldn't already have had you not had that surgery. And so recognizing the risk that you are taking and that you may, while really helping and improving the obesity issue, you may be taking on other health concerns is a really important part of the decision-making process. And then finally, we're going to talk about moving forward with surgery. Once you've finally decided, once you know what surgery you want to have, how do you find the right surgeon? How do you handle insurance issues? How do you prepare yourself from a nutritional perspective for surgery? And then the emotional preparation and discussing things with your family and other important people in your life is also really important for anyone who's going through bariatric surgery to spend some time thinking about.